What is a gummy smile? Hi everyone, welcome back to the channel. This is Dr. Madrasti Kurdar, and in today's video, I'm going to cover the diagnosis of a gummy smile and how to treat it. So recently I was playing a video game. It was called the Hackett Scory with some family members. And one of the main characters that's based off of an actual actress, she has a very distinctive gummy smile. And it got me thinking to make this video to, inform those of you who are interested in finding more about this condition and how to be able to treat it effectively. Now, um, basically the fancy term or the medical term for a gummy smile is excessive gingival display. That's just a fancy term to describe the excess amount of gum tissue that shows when patients, some patients smile. Not everybody has this, but some patients, when they smile, they show a lot of gum tissue, and they find that it's not really pleasing. Again, it's very subjective. We can't say one person's smile is better than another one, but if the patient themselves are having trouble smiling because they're very conscious of their smile and the amount of gum that shows, that's when we treat it. So one of the main causes that this happens is just genetics. Genetically, some patients have excess amount of gum tissue that shows. The gum line doesn't move up the way it should because, as we know, when teeth kind of erupt into the mouth, the gum and the bone around them have to move back with time. In terms of the upper teeth that would move up, lower teeth that would move down. But in some patients, it doesn't happen. And in those cases are where we see that excess gum tissue that forms. Another reason is, again, for this reason, there's also a genetic component. If there's an excess amount of basically jawbone that's present. So if the upper jawbone, there's excess formation of that will lead to excess gum tissue. And another reason is short upper lip. So some patients have a very short upper lip in terms of its length or width, if you want to call it that. So as soon as the smile, you can see more display of gum tissue. Another reason is a hyperactive mobile upper lip. So in some people, when they smile, the upper lip retracts all the way back. It's because of a hyperactive upper lip muscle. And you can see the whole width of the teeth plus the gum tissue that kind of shows. And that leads to that excessive gum display. Now, how do we treat this? So in terms of treatment, there are a few treatment options based off of the diagnosis. So we have to see what is causing that excessive gum display before we can even address the treatment options. Now, again, this is not a medical advice or dental advice video. If you do have gummy smile, definitely you should see your dentist. They would have to take x-rays, photographs, come up with a treatment plan, and tell you of the options available. This is just an informative video, so you can get a better understanding of the potential causes and the treatment options that are available. If the excessive gum display is due to just excessive gum tissue that's there, it's very simple. We would just have to remove that extra gum tissue. It's called the gingivectomy. So your periodontist would remove that excess gum tissue that's there. And by doing that, you expose more of the teeth actually and reduce the amount of gum that shows when you smile. In some cases, we also have to do what's called crown lengthening. We would have to remove a bit of bone around the teeth to expose more of the teeth and make everything more harmonious. And in some cases, that would be a combination of these two procedures that I just discussed, in addition to having veneers or crowns placed if you suffer from short teeth. So some patients, besides the excessive gum display, they also have shorter teeth. That needs to be addressed restoratively with crowns or veneers to make the teeth look longer, in addition to the gum surgery that needs to be done. So it would be a combination of factors. And in some cases, you would have to have orthodontic treatment or braces done to correct the occlusion as well. Now, if the excessive gum display is due to malformation or excess formation of the upper jaw, that would require a more extensive surgical treatment, usually done in a hospital setting, potentially in some clinics as well, that may be done, where some of the upper jaw has to be removed and it would be positioned a little bit higher up. That way, we would remove the excess bone and excess gum tissue that's present there, and that would lead to a more pleasing smile. If the excess gum tissue present is due to an hyperactive upper lip, in those cases, you could potentially have Botox done to reduce the mobility of the upper lip and thereby creating a more harmonious and more aesthetically pleasing smile. I hope you learned a thing or two about this condition. Please don't forget to like and subscribe to the channel. If there are any topics that you'd like me to make a video about or speak about, please let me know. And if you have any questions, please don't hesitate to just write in the comments, or again, just message me. You can also follow me on Instagram for more information. Thank you for watching the video. I'll see you next time.